It is new technology to North Florida and Southeast Georgia. Baptist Medical Center Jacksonville is now the first to offer Makoplasty hip arthroplasty. It is really designed to get patients back to their normal activities as quickly as possible, maybe more quickly than traditional hip replacement surgery as well. Joining me now is orthopedic surgeon Dr. Steven Crenshaw and patient Donny Harrison. Good morning, guys. Thanks for being here. I know that this really has been around since last year that you've been performing it. Doc, what's the difference between the old-fashioned way, we'll say, and this new way of basically using a robot? And I know that we have a picture of it to perform this surgery.
So the Makoplasty for the hip is basically a traditional hip replacement done with some newer technology. And in particular, we're using computer-guided navigation to help us orient the hip components in the proper position. And then implanting the components is done using the robotic guidance. So the whole idea is to implant the components more precisely, which we think will make them function better. We hope they recover quicker, and long term, we hope that they survive longer and that they don't lead to or don't have the incidence of failures that we've seen with some of the more traditional hip replacement approaches.
So it's interesting because other than a robot is guided by you, obviously, is performing the surgery, the components then that are used in the hip are different than what was used traditionally?
No, the components are about the same. The only difference is the approach that we take is done using a navigation system, which is allowing the robot to see the human, the anatomy, and using that to guide us in terms of putting the implants in. But the implants look the same whether it's a traditional hip or the new Makoplasty.
So, Donny, what did you think when your doctor came to you and said, yep, I'm going to use a robot to help me with this procedure?
That was kind of cool. Actually, because I was in a lot of pain, so I needed to get it done. And Dr. Crenshaw had mentioned, the new procedure and then the recovery time, because I had like 4 months pretty much for LOA, for leave of absence, and then having both hips done within a 3-week period. So when he kind of approached that and talked about the recovery time and how much quicker it could possibly be, I was all in. So.
And what was your recovery like then? I mean, how was it different? I mean, that's pretty bold to have both replaced just weeks apart.
Yeah, it was pretty intense. I think a lot of it had to do with me not like being in the hospital.
We share that sentiment. You're not alone.
But for the most part, it was pretty good because it's aggressive because they want you back on moving. So it was like surgery the next day, walking around. That evening, I was home. So it was good. And I had trust in him. I mean, you got to have trust in your doctor, and he's a pretty good guy.
Well,
so.
It's interesting. My sister-in-law had this procedure done last year, too, or a procedure like this, hip replacement, and they're pretty much that night making you get up and walk around, and it's like, wow, you can't imagine that you want them up on their feet that quickly. But and that begs the question then, is anybody a candidate for this particular kind of surgery, or is it limited to certain age groups or background in terms of, maybe pre-existing conditions?
No, I think the indications for hip replacement are the same regardless of how we do it. We are seeing a younger and younger population needing hip replacements, and I think the implications long-term of how these hips perform and how they hold up over time has to be factored into it. So anybody that has a bad hip that has failed conservative treatment and needs to have the surgery certainly would be considered a candidate for a Makoplasty.
What is making younger people need hip replacement surgery? Is it the exercise that they're doing, or they're not taking care of themselves?
Some of it is the success we've had in the older population with hip replacements, which were traditionally done for people with more debilitating, crippling arthritis. But as hip disease is present in young people as well, and people don't like giving up lifestyle and making sacrifices, the success is carried over to the point that the younger patients benefit from it sometimes more than the older. And it allows them to get back to doing what they want to do, whether it's exercising, working, just living without pain. And the downside of hip joint replacement is long-term. When do they fail? How long will they last? And what determines that failure? And I think that this technology at least takes into account some of those factors in terms of how the components function and how they're positioned to function, such that they may last longer. And for Donny,
that's lifestyle.
That's important.
Doctor, thank you for being here. Donny, appreciate it. Glad that you're doing so well.